body shape for you. And really, because everybody's different on what their goals are and what their anatomy will allow. And so Dr. Salazar is with us today, and he's going to be going over that with you. He's a board certified plastic surgeon and was voted as one of San Diego's favorite last year in 2019, a fellow of the American College of Surgeons as well. And so today we're going to talk about body shape. So here's sort of a ideal, but this, I thought you could talk about sort of the different ratios here.
Yeah, that's fantastic. And we have also all the pictures included, so I love it.
What do they mean by this hip to waist ratio?
Well, so let me tell you, Monique, I think this is a topic that I feel a lot of passion about this. In reality, that hourglass shape that we all have heard of and that we know, and that we can easily recognize, actually that hourglass shape is the most powerful sexual trigger of all. What I'm stating is not something I believe, I just believe, but it's something that has been scientifically proven. Dr. Devendra Singh in University of Texas in the Austin campus, she's a psychologist, and the study has shown that the most powerful sexual trigger actually is that hourglass shape. So that shape, as a matter of fact, it's unique. It's unique to humans. There's no other mammal, and specifically, there's no other primate there's no monkey, no gorilla, no other primate that actually has an hourglass shape capability. So nobody else can develop that. So it's such a human thing for us to be able to see that in our own species.
Is this, so somewhere sort of in this 0.65, 0.7 range? Is that sort of the goal, or does it depend on the person?
So let me tell you that we have something that we call ideal, right? I mean, we have a ratio that we call ideal, and the ideal ratio goes around from 0.6 to 0.8. And let me explain to you what that is. So in order for you to be able to if you want to go back to the previous slide, if you want to be able to measure where are you, what you need to do is you need to measure your waist. And where's your waist located? So your waist, you're going to touch and feel the lowest rib that you have. And you're going to locate your pelvic bone. That, for our purposes, is anterior superior iliac spine, but it's your pelvic bone. So you're going to go down, slide your fingers down. You're going to feel where your pelvic bone is. And then right at the mid-distance between the lowest rib and the pelvic bone is where the appropriate site for you to measure your waist is. And that tends to be around the belly button, maybe a little bit above the belly button or at the height of the belly button. But that's where you should be measuring your waist. The other thing is when you do it with a measuring tape, that you have to make sure that you do it after you have remove all the air from your lungs. So just make sure to take a deep breath in, and when you finish expelling all that air, that's the right moment to measure. So that would give you your waist measure. And then when you go down and measure with your measuring tape around your hip, you're going to obtain the second number. So where do you appropriately measure your hip? You're going to be measuring it at the most prominent part of your buttock. Wherever your buttock gets at its most prominent part, you're going to measure that. For the medical terms, would be exactly at where the greater trochanters are. That's how we say it in medicine. So to be able to obtain that 0.6 to 0.8 of ratio, you have to be having a waist of between 24, 28 with a hip of 36, or a waist of 27, 31 with hips of 40. And that would give you that classic hourglass shape that you want to be And in terms of the screen, you're going to see it ranging from where you see the 0.65 to the 0.8. And what that reflects is a healthier figure.
Okay. And so here I found a stock image of somebody who either had surgery or had a lot of weight loss, but it is definitely the same girl. And so just sort of giving an idea of that, it's sort of that thick middle, that here she's getting more of that hourglass shape.
Correct. And again, since this pictures, of course, these are not our patient pictures, the stock image, that could potentially be the same person that actually underwent something, or actually two friends that went and bought the same bikini.
Yeah. Well, her moles her moles seem
right
to
there.
be lining up. But so here, then I'll let you go into some of the before and afters of our patients, your patients.
Yeah, so definitely let me share with you that, in a way, how can we improve this? So of course, diet and exercise are essential, right? So with diet and exercise, of course, that's a very powerful tool, and you can be, as you approach your ideal weight, your hip to waist ratio is going to get better and better. The waist, that it's more driven by soft tissue, meaning skin and fat and subcutaneous tissue, while your bony structure will determine more about your hip. On top of the bony structure, of course, on the hips, you can also put on some weight, and you can put on some fat and some extra skin, but mainly that is going to be part of your bony structure. So where you're going to be able to modify the most by performing exercise and dieting, it's going to be on your waist. And the same thing with our different forms of intervention. So what we have on the screen right now is a patient that actually underwent a procedure. What she had was a mini abdominoplasty. And when we talk about a mini abdominoplasty, remember that we have a very small, limited incision just below or at the height of the level of the belly button, just a little bit below that, a little bit underneath there. But yeah, I mean, that's exactly the area. So it's a very short incision. You can think about it as 3-4 inches of an incision. And by pulling the center of the abdomen, we really do not modify a lot of the waist. We get rid of, as you can see, she does have less tissue below the belly button, but we added a little bit of liposuction on the sides, on the flanks, right there, and you can see how that hip to waist ratio was improved. Mm-hmm. Let me show you the next picture, and you can also appreciate it over there. By us being able to push in the abdominal content with that. With the mini abdominoplasty, and also doing some liposuction on the flanks, on the sides of the abdomen, and also on her lower back, we were able to achieve a much better hip to waist ratio. Just imagine where you have that arrow over there, if you measure all the way around the waist, and if you measure on the other image all the way around the waist, definitely there is an improvement.
For sure. Now, did she have any fat transfer, or because her buttocks look way better, and is that
it's great that you're pointing that out. No, she did not have any buttock work, but by decreasing her waist, by decreasing the measure around her waist, you accentuate the buttock. You create a much better transition from the lower back to the buttock, and that generates an image that she has had something done on her buttock, and actually there was nothing done to her buttock. And I'll show you at the end another picture of a patient that just by creating the same, let's call it illusion, you're gonna improve the way the buttock looks. Let's go to the next picture. So in this patient, you can see I wanted to let you see that incision to show you she had a regular tummy tuck, and in her case, what we did was a This is pure tummy tuck. There's no liposuction. We pulled the skin and we did the plication. So let me explain to you what we did on her. So basically, if you see on the before picture, and pay attention to the skin just above the level of the belly button. And basically the skin that's being pointed right there by Monique, it's exactly the skin that lives all the way down. So we were able to pull down all that much skin and eliminate all the skin that Monique is pointing out right now. And by pulling there, we really accentuated her waist. And if you want to go to the next picture.
And let me just say one thing. Now, from the layman's side, here's that mole, here's that little or freckle, and here it is after. So you can see how far it traveled just coming down. So then her belly button stays where it is. You just make a new incision around.
A new window, right.
Yeah, a new window. That's a good way to put it.
Yep.
Okay.
And if you, okay. So that just by pulling that skin, you can get a little bit of accentuation on that, on her waist. Now, the other thing we do is we also bring the muscles together. So when we have, and the way I like to put it is the skin and fat open, just like a lid that we can lift up, and we can see the muscles. And what we do is we bring those muscles together with 3 layers of stitches. And by doing that, we make the patient tinier in the inside, and that also gives a good accentuation to the waist.
Okay. And so, and is that sort of why you see the outside of her tummy right now, and here you don't? Is it because it's been pulled to the middle?
It has been pulled to the middle, and that's like it works like an internal corset, and that immediately gets them a much better shape. Now, the thing is, as you can see, that when we're talking about the hip to waist ratio, the hips, it's really hard for you to modify that, but definitely the waist we can modify that, as it's not much dependent on the bony structure. So that's the reason why. Let me take you to the next patient. The next patient, what we did on her is a very particular operation. What we did on her is a Fleur-De-Lis Abdominoplasty. What that is we do not only remove the horizontal excess of the skin, but we also remove the vertical skin excess. So what happens here is this patient has so much excessive tissue that by doing a traditional abdominoplasty, a tummy tuck, we wouldn't be able to eliminate it all. So we have to add a vertical incision that you see in the middle. The scar, in her case, these pictures are from 2.5, 3 months after surgery. So that scar, it's gonna mature much more. And by a year, it's only gonna turn into a very thin white line. And you can see how much skin we have removed, and you can see how much her waist has been accentuated. And I mean, imagine the relationship, the 0.6, 0.8 relationship that we're looking for. Definitely we have achieved it on her. And let me show you the next picture, and you'll see how much the results are dramatic. We did not do any liposuction in her case. When we do Fleur-De-Lis abdominoplasties, it's truly a surgery that it pulls a lot. If we add liposuction, we can really compromise the skin viability. So some of the skin will not can suffer. So that's the reason I do not combine the Fleur-De-Lis abdominoplasty with liposuction. At this point in time, she would benefit from some liposuction just underneath her bra line. Yeah, exactly. You see that was present before, but now that she's got such a great waist to hip ratio, now you can see it even more. But we didn't touch that part. I don't know.
You could,
I mean, with her about her operation.
Yeah, it's incredible. And really, I mean, gosh, I think for people, in this camp, clearly the trade-off of the scar is so worth it, because just to look better in clothes and dresses, and sure, that scar will mature. But, most people aren't going to be like running out to get their first bikini. It's more about, how do I feel every day in all my clothing, in my one piece, that kind of thing. Because I think patients do tend to obsess about scarring a little bit, but it's like, but look at that trade-off. You couldn't get that any other way.
And let me tell you a secret, definitely not a patient that really and truly needs the surgery. When you see the patient on the left side of your screen, and when you talk to them about that scar, nobody even double thinks about the scar once you can see the results, because we share some pictures of previous patients with them, and they say, you know what, Dr. Salazar, that scar, that line, it's not going to do me any bad, so just forget about it and go ahead and let's do it.
Right.
And when they're after surgery and you talk to them about that scar, it's really something that they don't even see. Even though, the scar is still going to be there, but they don't take it into account because they have to go and shop for a different closet. The closet entirely has to change. So they're really, really happy and
Yeah.
thrilled.
And something like this, like, let's say she did want to come back and she wanted to take care of maybe this bra line, up lower back fat or upper back fat, would that be something she could do that would be pretty easy? Like, would it be a pretty involved surgery or pretty simple?
No, I would say pretty simple, straightforward surgery with some liposuction, and that much of tissue would totally allow for retraction, for shrinking, and she would get a very nice result. Like, for instance, this patient, if this patient would come in and ask for pure liposuction, for instance, because it happens sometimes, patients walk in with that. With her body, and they would ask for pure liposuction, and definitely she would not be a candidate for pure liposuction. But for that specific area, yeah, we could easily do that later.
Okay. And you ready for the next one?
Ready for the next one? Perfect. So that's a patient in which what we did is we did pure liposuction. And you know that we've talked about on the past and previous webinars, we've talked about HD liposuction. In her case, we only did pure standard regular liposuction. We did not do any muscle edging or anything like that. But definitely you can see how with pure liposuction, you can also accentuate and change the hip to waist ratio. And I think we do have some lateral views of her. There you go. And again, that you can see how the skin has retracted, has shrunk very nicely after the procedure. And if you measure her waist, you measure that has shrunk. Her hips are still the same. So that relationship between the hips and the waist has changed favorably. And she's very pleased.
Yeah, she looks amazing.
She looks really good.
What's the recovery on something like what she went through here?
In terms of recovery for just pure liposuction, I like to tell patients that it's a very short period. It's about for them to feel fine, it's going to take probably 4 to 5 days for them to feel good, to feel fine. They're still going to have to wear the compression for about 6 weeks. I'm very strict on that, compression garments. For them to exercise, I tell them 3 weeks to exercise, just to not to face any bleeding problem or anything. So I would say 3 to 4 days to feel fine, 3 weeks of no exercise, 6 weeks of getting that compression to shrink better.
And just since we were just on it, if we're looking at somebody with this extensive surgery, what would be the recovery of that one?
So the recovery for that is it's quite similar in terms of feeling well. You would say that it's feeling well. They're probably going to feel well after a week. In terms of not exercising and heavy weightlifting, this one, we asked them for 4 to 6 weeks of not lifting anything heavier than a gallon of milk. So we extend that a little bit on this one. And in terms of the compression, it remains the same. It's about 6 weeks.
Okay. So we'll go back here to the lipo, and then our next I think
Now, this is HD liposuction, and I wanted to share this picture with you and the following one because in this two cases, what we did is we were purely depending on the liposuction to obtain that result. Now, you might think that we did something to her buttock again, and over here, the answer to that is absolutely not. We did not touch her buttocks. What we did is we just accentuated the transition between the lower back and the buttock, creating a much more rounder effect on the top of the butt. And then we give her that very accentuated hourglass shape. Some patients want to have it very accentuated. Some patients don't want to have it very accentuated. And we can accommodate for that. But definitely just to share with you the power that HD liposuction has and what an impact it can cause.
And just for the people in the audience who might not know what HD liposuction means, could you give us a quick rundown?
And so for that is high definition liposuction or high def lipo. What we do is we use similar instruments than what we use in regular liposuction, but all the principles and the technique varies completely. What we do is we basically go ahead and empty completely, entirely the deep fat compartment. And then with the superficial fat compartment, what we do is we sculpt it. So we delineate the latissimus dorsi muscle, which is the largest back muscle. And then that's how we are able to create that shape. And the same thing, we demarcate the upper portion of the buttock by sculpting it with an oscillating liposuction cannula. Imagine like a piston that goes back and forward, and it breaks the fat so we can actually sculpt it better.
And just for the audience who might be on Instagram, we have on our Instagram stories, we have quite a few times where I've gone in the operating room with Dr. Salazar and filmed sort of a live, if you will, like version. And so I've actually gotten to see it happen live multiple times, and it's fascinating. And so those stories are saved in our Instagram highlights. So on our main Instagram page, you'll see little circles, and you can kind of scroll through and find the HD lipo ones. And he explains what he means by emptying those compartments. And it's quite fascinating.
This is another patient. She also underwent HD liposuction, and you can see that hourglass shape that's much accentuated. If you see her on the left side of your screens, you see that person. It's not an overweight patient, and it's not. I mean, it's a patient that's thin, and I mean, you can tell that she exercises, but in reality, what she wanted asking for is to have us accentuate that shape a little bit more, and for you to see the power of the surgery, just look at the size of California. I mean, California shrunk, and it's a much smaller shape now, and definitely you can see that retraction, that power, and you can see how we delineate those muscles in the back. And she looks much more fit. Also, the buttock has now a much more accentuated shape, and it's something that, I mean, patients really, really appreciate, and we did not even touch the butt in terms of putting in fat or any other technique.
Yeah, it's amazing. It's like you say, she's not heavy here, but now when you look at her before versus her after, she looks like she's lost 25 pounds. I mean, it's amazing.
Correct.
And do you happen to remember quite kind of how much volume you took?
I would probably say in her case, we were around 3.8 liters. So imagine those Coca-Cola bottles of 2 liters that like family size. So imagine almost 2 of those of fat.
Wow. And then our last picture here.
So our last picture there is it's a much more conservative result. This picture here, let me ask you something, Monique. It's this one, do you think we did some surgery, or do you think we used something non-invasive? Hard to tell, right?
I have no idea because I don't see any incision marks.
Right, so you're correct. So we use something non-invasive, and what we did over here, and you can see right at the transition, go and point at the narrowest point. Right, it's hard to find it there, and it's easier to find, yeah, exactly. It has come down, it's a little bit lower. So the way we alter that was with Coolsculpting. So Coolsculpting is a system that we do have available as well in our medical spa. Patients love that. It's a non-invasive way of freezing fat and destroying fat, basically. It decreases the amount of fat, and the way we like to approach it, this is not liposuction, right? This is non-invasive. It's a system that it's going to be applied on top of your skin. You're just going to be reading a magazine, watching a movie on Netflix on your iPad, listening to some music. And it takes several sessions, but you can definitely see a change, and it's a gradual change that you're going to be obtaining. It's non-invasive. We do not make any incisions. The recovery is extremely quick. There's like no time for, like no real downtime for exercise and compression that needs to be worn and all that. It's less strict of a post-procedure care, but definitely it's another option. Sometimes we combine this option. This is more for a localized fat area that has been stubborn, doesn't want to really respond to exercise, but very, very localized, and you get a very nice result like the one you're seeing.
Yeah, she definitely had some extra right there and right there. That's much better. And so we're going to go to questions. So I have a question here. It was back when we were talking about the aftercare, sort of. I think we were back over here on who was our liposuction patient. Was this the liposuction patient?
Yeah.
They were saying, can they do walking after lipo in the first week?
Definitely, yeah. And we actually like to encourage, with all these procedures, we want the patient walking right away. And the first 2-3 days, it's a little bit difficult for patients because that's against what their body is asking for, right? Their body is asking for them to lay in bed and kind of be pampered, but we actually encourage walking for blood circulation purposes. It's really important for patients not to stay in bed at all times. So we actually like what we call early ambulation, for them to start walking actually the same afternoon that they got surgery. And so that promotes good blood flow. They feel better, they mobilize fluids, and definitely that first week is key for that to start happening.
Okay, and another question, and feel free, as you guys have questions, to type them in the Q&A, but I'll just go through them. I have another question. Will adding volume to the buttocks help with the waistline definition?
Yes, 100%. So if, again, the way we can modify, as we were saying, those two components, either the waist and the hip, if we add some volume at the height of your hip, which is composed as well by the buttock, then we are going to be improving that hip to waist ratio. And you can actually, I mean, right there, we did not add volume, but imagine if we would have added more volume and we would have allowed her hip to, her waist to shrink, then that relationship opens up, and then you have a much, much better ratio for that anatomical area.
And when you do let's say a fat transfer, if you're adding volume, you take it from somewhere, you're moving it, how long does that last?
So the fat is living tissue, right? I mean, we think about fat as something static or some sort of an implant, but in reality are living cells. So when we harvest those cells from the belly or from areas that you have excess or where you don't like it, we are actually performing a little transplant, because those cells are alive, and we very carefully harvest them, we process them, we clean them, and then we graft them, we injected them. And that fat is your own fat. It's going to live there. Not all the fat that we transplant survives. We estimate that anywhere from 65% of the fat that we move actually is going to take. We call it engraft, actually is going to stay there and survive. So you can think of that 60 to 65% of the total volume that we move will survive, will make it, and that is yours. And that stays with you forever. That's your own fat living happily in the new site and giving you a much better shape.
Okay. And let's see, another question we have. Can you get any definition with a tummy tuck since you're tightening the muscles?
You do, yeah. As I was showing you, yeah, even there, you can see how everything has been pushed in. So when we tighten the muscles, just by bringing those muscles together, you can see how things can be pushed all the way in, meaning we never, when we do these surgeries, and it's something that's important for our patients to understand, we never see the bowel. We never see the abdominal content. We just reach the level of the muscles. But when the muscles relax and separate, what happens is that the bowels, let's say, they live in a larger cavity. So when we bring the muscles together, we push the stomach and the bowels and everything, we push it all the way in, and definitely that gives a much, much better, well-contained waist.
Okay. Now, this person says, I have loose skin, so probably need a tummy tuck, but I also have back fat or muffin top. Can you do liposuction at the same time with the tummy tuck? And if so, do you do liposuction and then remove skin?
So when we do a tummy tuck, we definitely are removing skin from the front and the sides. When we combine that with some liposuction, we decrease the amount of fat. And when we do liposuction, we depend on the skin to be able to shrink. If for any reason we think that skin is not going to shrink enough, either because of the amount or the skin quality or a very advanced age of the patient, what we can do is we can actually extend that incision of the tummy tuck and carry it all the way towards the back. And by doing that, we can also eliminate. So if you can see that
so
incision,
sort of instead of stopping here, you would keep going around.
We keep going around.
Yeah.
And definitely that helps. But that's only if we think that the skin will not retract appropriately. The skin on the back, especially in the lower back, responds really, really well to liposuction. And yeah, as you can see, it shrinks really well. And as also you can see, and even better if we do it with HD lipo, as we saw with those two patients. Another thing, Monique, that I wanted to share, I've gotten the question a couple of times from patients about having ribs removed in order to decrease the measure of their waist. Have you ever heard that?
I remember from like Victorian novels, where they would talk about, I don't remember which books, but I just sort of remember hearing about it from a long time ago. Was it or is it a thing that people they remove the ribs?
Right. I would totally say that's a myth. So let me tell you a little bit about it. I mean, let's try to think about anatomy, and then so we have 12 ribs. Those 12 ribs, the last two are exactly, that's a great picture. The last two ribs are even floating. So ribs 11 and 12 float. What that means is they do not contribute to your figure. They do not contribute to the waist measure. So if you really want to alter that, you're going to have to resect ribs that are not floating ribs. So not only rib, you would need to resect the rib and cartilage. In addition to that, just think about this. Plastic surgeons, it's not that we're magicians. We have to make incisions. The only thing is we're really good at hiding those incisions, and we are really good at making those incisions really, really thin. But if you're going to resect a rib, where are you going to put that incision to get rid of that rib? So that incision has to be very visible. So removing a rib, number one, it's extremely difficult, and it's very invasive to achieve a cosmetic procedure. You would have to get it into serious trouble by removing ribs that are truly contributing to your body shape. You're going to have a very noticeable scar. And then lastly, I challenge people to go into plastic surgery books and look for a chapter that talks about rib removals. You're not going to find it. So no, that's totally a myth.
Urban legend or something.
Exactly.
But do you get patients asking about it?
A couple of patients asked me about it, and as a concept, they didn't request it for themselves, but because I truly find it really hard for someone to request it, but they asked me about it. If Dr. Salazar, do you perform rib removals? And no, definitely not.
That's where you're going to draw the line. So
exactly.
now, if somebody is trying to make a change to their shape, but they might want to have another child, let's say they've already had a child, but they're, sort of toying with, do I have the third kid or do I, have some changes? What would you recommend? Would a tummy tuck obviously maybe isn't the right thing, but maybe could they do liposuction or HD lipo, or is it better for them to decide on their childbearing concerns first?
So it's a great question. Definitely with pregnancy, the body will change. Some patients even ask, if you perform a tummy tuck, am I going to have a problem with my pregnancy? The absolute answer to that is no. There's not going to be any physiological or biological problem with the pregnancy itself. The only thing is, as your body changes, you might lose the result that you had. Or for sure, temporarily, you're going to lose it. Can you shrink back to where you were if you had surgery? So let's say that you decide to go and get a tummy tuck, you get the tummy tuck, you get a very nice shape, then you get pregnant, then you lose the shape for sure. Can you go back to where you were, meaning after surgery? And the answer is yes, you can. There's a possibility. There's also a possibility that some skin will not shrink. So truly in there, it's a coin toss. You really cannot predict exactly how your body's going to react. You've seen, you've heard, you have some friends that on their first pregnancy, everything went back to normal. On their second pregnancy, well, maybe not so much. Things can happen. Body can react differently. What I like to tell patients when they come to see me for a tummy tuck is two things. One, how's your weight right now? Is your weight stable? And if they say, yes, my weight is stable, I'm not planning to lose any weight at this point, all right, so I think we can proceed with surgery. If they tell me I'm actively dieting right now and I'm actively losing weight, what should I do? Well, you know what? We've met, we like each other, let's meet again in a month. And let's see where your weight is, and let's continue monitoring you. Mm-hmm. If they say, I'm planning to lose weight, or I planned and I haven't been able to, if you have tried, and I mean, I sometimes think that I also would like to be, I mean, I'm a tall person, but I would like to be 7'7" and play for the Lakers, but I'm not going to be able to, right? So if they're in their weight, even though it's not their super ideal weight, and they want to proceed with surgery, it's okay. The same thing and the same concept applies to pregnancy. If they're actively looking to get pregnant, if they tell me, Dr. Salazar, me and my husband are working, me and my partner are working in order to get pregnant actively. So it's great. I mean, we had a nice visit. We enjoyed each other. That's great. now you know my philosophy, let's regroup after your pregnancy. I think that's really, really important. But if a patient thinks that would benefit from a tummy tuck, and they actually do, and they are not actively looking to get pregnant, and they maybe are going to get married in 3 years and start looking to get pregnant then, and they definitely are a good candidate for surgery. And if their body changes, they might need a little touch up later. But definitely for them not to miss all the benefits of this surgery, and being able to enjoy a nice two-piece bikini.
Yeah, yeah. So what are when you were talking about HD lipo, how long, let's see, what was the question they said? Oh, when do you notice the final results?
So for HD liposuction, you'll start seeing results after a week. After a week, you'll see for this type of surgery that, let's say, the bulk has been removed. You can notice that right away. But in order for you to see the new shape with all the definition and the new curves, you're going to be seeing that. Start to see it at about 6 weeks. At about 3 months, we get the first real pictures. At about 6 months, you have a very good idea. But it takes some time, and the recovery is as we discussed, but for you to see the results, wait and be patient. And in about 3 months, you're going to have an extremely different figure.
Okay. So I think let me just make sure I got all the questions. I think I did.
There's one more thing, Monique, that I was thinking as we were discussing pregnancy. I've heard, I haven't seen a patient, but I've heard stories of patients that actually they undergo a C-section, and they had a tummy tuck done either by a non-board certified plastic surgeon or even a gynecologist, an immediate, like kind of, when we talk about immediate reconstruction, they get an immediate tummy tuck after a C-section. This, I do not recommend to have this done ever. The body is still, it's something that you had a baby, the uterus is at a completely different size. And for patients to even consider, or doctors to perform a tummy tuck right away after a pregnancy is over, meaning the day of your C-section, please stay away from someone who recommends that, or would agree to perform that.
Yeah, that sounds scary. And let me ask you, but let's say, how long should they wait though? Let's say, okay, they're done having babies and they want to have their mommy makeover. About at what time do you want to see them for a consult? And then how long do they have to wait till have surgery?
I would have two things into consideration. One is actually the shrinking of the tissues and everything. For those purposes, I would say at about anywhere from 3 to 6 months, that would be fine. The other consideration is, are they breastfeeding actively, right? Because we're going to be performing surgery, we're going to be giving them some medications, and some of those medications, actually, you don't want to share those medications with your baby through milk. So that's, if that's the case, if they're breastfeeding, to postpone the surgery maybe after they're done with that part. And the third aspect of that would be to also patients, for them to consider holding the baby. Because remember of the do not carry anything heavier than a gallon of milk. So some babies are actually going to be on the heavier side, and for them carrying their babies, or at least they would need to get some help in order for them to prevent any problem after surgery. So those three things, I think, would be the three ingredients right after they have a baby. First, at least to wait for 3 to 6 months for the tissue to shrink. Second, consider the breastfeeding situation. And third, make sure that someone is out there to help you with the baby.
Yeah, that's great advice. So one of the things that we're doing right now through the while we're under the COVID-19 situation is we're doing a lot of virtual consultations. And so if it's something that you're thinking about, how can I make a change to my shape? We invite you to set up a virtual consultation with Dr. Salazar, because you're going to be able to meet with him one-on-one. We have a chaperone in the room, whether it's a patient coordinator or a nurse, and they take all the notes, just as if we try to make it as much like you're in the office as possible. And we use a HIPAA compliant version of Zoom, so it's safe and secure. And so that's something that you can set up with our patient coordinators, and you can either call or text us or email us, and they can walk you through getting that set up. And how have you been finding the Zoom consults going, Dr. Salazar?
Monique, extremely, extremely well and very pleasant. Honestly, and I share that with the patients that are listening, or even potential patients that are listening to us. I was a little skeptical at the beginning. We've been doing virtual consultations forever, because some patients, when we get patients from out of town, from out of state, and even international patients, we have always performed that first virtual assessment. But now that they're turning more into a daily thing, definitely I was skeptical that if they were going to be taking away that human part of a consultation, that handshaking part. Now we cannot even shake hands, so it doesn't make a big difference in those terms. But definitely, it's a moment that it's a different moment for people that are at home. For us, it's an opportunity to share our philosophy with patients. We can listen what their concerns are. We can learn from about their goals. We dedicate a full hour, if needed, to talk to patients on Zoom, and we have a real fun hour. We have it's all with on following all the safety precautions. Of course, we don't have human contact. We keep our social distancing, and at the end, we formulate a very, very nice plan for those patients. They get a very good idea of what a economical, what a quote will be, and then, as we are planning to come back and perform surgeries again, we definitely set up dates for them to come for a preoperative visit, and during that visit, for us to perform the last part that we were missing, the real physical examination. We push on their bellies, we measure their breast. It depends on the different areas, but for sure, for us to be able to keep it very safe and make sure that all those physical findings are lined up to get a good result.
Wonderful. Well, thanks everybody for joining us. Thank you, Dr. Salazar. This was
thank you, Monique.
Super informative, and I hope everybody enjoyed it. Sorry we had some technical difficulties at the beginning, but we got it done, and then I'll be posting this up for everybody to see, to watch later if you happen to be one of the people who missed it. So thank you so much, Dr. Salazar.
Thank you so much. I really enjoyed it. Thanks,
Okay.
Monique.
Bye.
Bye.